And I have to say, with no influence from myself, we are back on time. I'm just going to check. I've just had a couple of texts. I'm just going to make sure they're not to do with the meeting. No, we're fine. Okay, so our next speaker is Deirdre Staunton. Ah, there she is. I was wondering if she's in the room. That's why I was checking my text. Good to see you. Deirdre, I've been claiming all month, belongs to Sligo, but actually comes from Mayo. I read in her bio. So she's been in Mayo, but she's come from Mayo, but has been in Sligo for a number of years. Deirdre first came to Sligo in 1987, where she completed her nursing training. She worked then predominantly in coronary care units, both in Dublin and Sligo. And in 2006 was awarded a Bachelor of Arts in Education and Training at NUIG. Over the last 22 years, she's become the Resuscitation Training Officer in Sligo Hospital and developed the service, and is well known, I'd say, to all of us in Sligo. Recently, Deirdre was diagnosed, it seems recent to me, I'm not sure, but recently Deirdre was diagnosed with lung cancer and has been living with this, and this is the month of lung cancer promotion. And so Deirdre has kindly agreed to come and tell us about her experience of living with lung cancer and also educate us around lung cancer. So we really appreciate you taking your time and your willingness to come among your colleagues and speak about this. Thank you so much.
Do we press something? No. Oh, yes. Okay. Oh, there we are. That's the one I'm familiar with. Thank you. You've got my bio, so I won't bore you about telling anybody, because a lot of you know me already. It's great to see you here, and thanks, Anna, for inviting me to tell my story today, which is the 25th day of Lung Cancer Awareness Month. I never thought I'd be here. Every 18 seconds, somewhere in the world will die of lung cancer. So therefore, before I go on to my next slide, at least 3 or 4 people will have died of lung cancer. 2,700 cases are diagnosed annually in Ireland, with 1,800 deaths. More people die of lung cancer in Ireland than any other type of cancer. It's the biggest killer, causing more deaths than breast and prostate cancer put together throughout the world. It's the 3rd most common cancer in men and the 2nd most common cancer in women. The Irish Cancer Register will tell us that 6 in 10 of cancer patients are diagnosed at stage 3 or stage 4. And that's horrific. You know, it's at a late stage when they're not eligible for curative treatment, and survival is very poor. The Irish Cancer Society carried out research recently and found 1 in 2 people were unaware of lung cancer symptoms. And this is not good enough in the year that we are in. We're all very aware of public access or public campaigns, public awareness campaigns for other types of cancers. But when it comes to lung cancer, very little conversation is held publicly about it. I will accept that some people are working very tirelessly in laboratories looking at cancer cells and coming up with new treatments. But for the public out there, very few of us are aware of the symptoms, and a lot of people think that there's a stigma attached to it, that it's a cancer people who smoke get, and people are very slow to speak about it. And that's possibly one of the reasons why it gets diagnosed at the late stage. Today I want to tell you my story. I want to raise awareness about this disease and give you an insight into what it's like to be given life-changing news and to be at the receiving end of healthcare rather than at the delivery end. It's difficult giving a presentation. Anyone who's spoken here today will possibly agree if you've ever given a presentation. It can be difficult, and it's really difficult giving a presentation before lunch. And it's extra difficult giving a presentation before lunch, and giving a presentation about yourself. But if I can encourage just one other person to seek medical help sooner than I did, and if I can change attitude around lung cancer, then all of this will have been worth it. You have heard my bio, so I just put up those pictures just to prove that it is what Anna said. I went from nursing into education and really enjoyed my job. But the most thing I liked about my job was being a member of the cardiac arrest team or the emergency team and having hands-on care with the patient. I have been no stranger to conferences, and in fact these 3 pictures were taken at the last 2 conferences that I attended, and they were just before COVID. I haven't been at this, my first conference since COVID and since my diagnosis. Funny enough, the middle picture there, you're wondering where I am, that's me on the trolley. So Yeah, it seems a bit strange now, but I was acting the part of a patient. Little did I know that I would be a patient before COVID left the environment. So, and in fact, I'm just looking at the poster presentation there at the IAEM, that was in Sligo, just pre-COVID. But in fact, when I was putting this together, I was remembering that I actually did receive a prize for a poster at the Research and Education Foundation conference many moons ago, and here I am on the other side of things today. This is just, yeah, so you might have wondered about my title, The Show Must Go On, because I suppose I'm embedded in drama and musical theatre, and a lot of you know this side of me. But the reason I put that up was because during the last musical production I was involved in, I noticed that I was finding it difficult to hold the note at the end of a bar, and in fact made sure that I was always standing beside a good soprano who could hold the note. So I mimed, if anybody was at our last productions in the Hawks, well, I was miming a lot of those last notes while somebody else sang them. But it never dawned on me that that might be unusual. And the other part of my life that people might be familiar with as well is the active life that I have led. I would be found running around the town at night after work. I mean, 5 kilometres, 5 nights a week is usually what I did, with longer runs at weekends. And mountain climbing and hill walking was something I absolutely loved to do. So you probably get the impression now that she hates housework. I mean, I was always out of the house, but I've been a pretty good mother. I've raised 3 children, but outside activities I liked. And it was while doing these activities that I noticed in the winter of 2020 that I was getting extremely short of breath while running a 5K. In fact, I had my little Ventolin inhaler with me, and I'd have puffed it 3 or 4 times during a 5K run round the town in Dooley Park, which was unusual, but I didn't think a whole lot of it. Climbing mountains was another thing that actually I noticed that I was extremely short of breath, so I noticed that if I stopped talking while I was climbing, I'd climb fine, so I didn't think it was a problem. I also complained of tiredness, and I must have complained so much that I really got on the nerves of my friends, because a friend of mine said, probably in November, December 2020, she said, if you don't go to see a GP, I'm going to make an appointment for you. I'm fed up of listening to you speak about your tiredness. So I didn't speak about my respiratory symptoms because really and truly they were no big deal. I had asthma since I was a child. Now, it never caused me any problems and it never held me back, but I was putting the change in my respiratory health down to my asthma. So I did go to a GP. I followed my friend's advice, but I was going to the GP with the tiredness because, my God, the tiredness was phenomenal. I woke up more tired than I went to bed at night, and it was really getting me down, and it was affecting my humour because there's nothing, as you know, there's nothing worse than being tired. So I went to my GP in February of 2021 because, you know what, I really had nothing sinister and there was no need to go to the GP. And I felt it was probably the age that I was at. It was perimenopause. All women perimenopause are feeling tired, as the men in the room will know from listening to them. So I was putting it all down to, you know, uncontrolled asthma and perimenopause. And I did go to the GP and she took bloods and I was so excited. She started talking about vitamin D deficiencies. And I thought, I'm going to get a dose of vitamin D and I'm going to be fantastic by the time COVID is all over. I happened to mention to her on the way out, actually, when I was putting on my jacket, I remember I said to her, you know what? I said, I'm actually thinking that my asthma is out of control and I'd need to be referred to the respiratory physician in the hospital. I saw her 8 years previously. She'd swapped around my inhalers and I was doing really well. So the GP agreed, and what she decided to do that day was to refer me in for respiratory function tests, lung function tests, and a chest x-ray so that the respiratory physician would actually have those in my file before she saw me. So I was all excited at the prospect, not of the respiratory physician, because my respiratory problems were not causing me any problems. They were nothing sinister. I was fierce excited about starting vitamin D tablets. Yeah, I thought that was going to cure me. So I got the appointments and I had my chest x-ray appointment for March 19th, 2021, which happened to be my birthday. The picture there in the middle is of, that was Paddy's Day, 2 days before March 19th, 2021. So the middle picture is March 17th, 2021, when myself and my family and my best friend's family climbed a local mountain range in Glencar, because that's just the sort of thing that we do. We had a couple of bottles on the way down the mountain, I have to say, because everywhere was closed and it was Paddy's Day, and we wanted the children to have memories that we were very close to the ground. I don't want anyone thinking we came down the mountain two sheets to the wind. But it was a fantastic day. And then 2 days later, I got up and I went into Sligo University Hospital and I had a chest x-ray. But before the day was over, I ended up having a CT scan. So I'll just tell you a bit about that. I went in for my chest x-ray, had it taken, and went to leave because I had a very busy day planned. We were going to climb Knocknarea. And the radiographer said to me, would you just maybe stay in the changing room, do get changed, but stay in the changing room. We might want to repeat that x-ray, which I didn't find a strange request because that often happens in hospitals when they have to repeat the x-ray. So I did wait, and I waited and did a few emails and thanked people for wishing me happy birthday. And then the radiographer came back out to me and she said, would you mind coming inside, Deirdre? One of the consultants wants to speak to you. So I didn't think there was hugely, anything to worry about this. And I went in to speak to the consultant. And that doctor said to me that there was something abnormal in my chest x-ray and that I would really need to have a CT scan done that day, and that she'd already spoken to the emergency department team, and they were expecting me over. They were going to do a workup for this CT. So there was no big alarm bells when I heard all of this. Maybe an orange alarm bell, but really it was very short-lived because I was so busy. I really wanted to get home and get on the gear for climbing mountains. I didn't have time for all of this, but I thought, oh God, I better get this seen to. So I walked over to the emergency department, and I still didn't feel any anxiety, even though I was escorted straight away. It was like they were waiting for me, but I didn't realise it at the time. And I was escorted into one of their side rooms, which we know are like gold dust. So something should have ding-donged in my brain at that stage, but it didn't. And shortly afterwards, one of the consultants came in to me and she mentioned words like tumour, significant size, and other changes in the lung, and the fact that I needed a CT that day, and they would work me up for one now. And I still, because there's no way it could have been lung cancer, I wasn't worried. I thought I was thinking TB, maybe I picked up COVID that I didn't know I had and they found something strange. Maybe I aspirated a feather, because I know I had an aspiration incident on stage when I had a feather thing around my neck years earlier. And I thought, Jesus, is the feather stuck in the lungs? Honestly, that is what I was thinking. And so I went into this side room even after I had got news. And the news that was given to me, firstly by the ED consultant, was the tumour, and that was just enough for me. That was just a nice bit of information like that. And it was delivered to me by somebody that I worked with, by a colleague, and somebody that I was friendly with. So it was very difficult for her, I think more difficult for her to break the news to me than me to be actually hearing it, because it went slightly over my head. But I waited in that room, and I have an excerpt here from a book that I'm currently writing, and the book will be in shops eventually. It's titled, But You Look Great. And this is, I suppose, really a synopsis of how I was feeling when I was in that side room and the door closed. I am alone. I experience an overwhelming feeling of loneliness. My colleagues are all busy all around me, and I'm in a room alone, and nobody knows that it's me that's in here. I can hear my everyday working life outside this door, and I so very much want to join in. I want to be on the other side of this door. I want to be part of the team looking after this patient in this room. I want to be outside this door, on the outside looking in. I don't want to play the lead role in this nightmare. So I sat there, and I was, I suppose, my isolation was broken up throughout the few hours that I was there by nursing staff coming in and by medical teams coming in, because I had worked with these people and everybody was, of course, very concerned for my welfare. But it still hadn't dawned on me, I suppose, the significance of this, because I had such a busy life. I didn't have any bad habits. And I never thought of lung cancer, simply because nobody speaks about lung cancer. And it just never entered my head. It was hinted at me by the consultant that I should ring my husband, but I didn't take her up on the hint because I'm very independent and he was very busy and I needed to get out of hospital because we were going to Strandhill to climb Knocknarea. So I didn't call him initially until she came back into me and insisted that I call him, that he really needed to be around for when the CT scan results were reported on. So I still wasn't believing her, but when she said that she would ring him, I said, no, I'd ring him. So I did. I took the hint and I rang him. I had the CT scan, and then we had to wait just for the lunchtime period until the doctors were back and the scan was reported on. So the two of us then sat in that room. And then the results were in, and this is how I felt. I suppose I felt that I was in the middle of that wave, crushing with emotions, I suppose. And there was disbelief, there was grief, there was, I suppose, sadness. And there was huge isolation and loneliness, because even though I was in the room with 3 other people at this stage when I was being told the news of the CT report, I was the only one with that diagnosis. So it was a terrible place to be. But just going back to breaking the bad news, what one of the doctors said to me then, I mean, I was swimming in this tsunami and I was drowning. And the consultant said to me, "How are you going to tell your children?" And gosh, that was the best thing that anyone could say. I don't know if it was a technique, but anyone who has to break bad news needs to be very aware of the words you can use. And that actually settled me. And I suddenly started swimming away from the waves to dry land and to high land. And I got there and I went home that evening. And we celebrated the birthday. We had pizza and a couple of drinks and a cake. And then later on that night, I told my children. And they were 18 and 16 and 20 at the time. So they were at a good age to take it all in. And I had to be brave. I couldn't be trying to outrun the tsunami anymore. I had to get out of it. And they were great, I have to say. My family is great. So for a while after the CT report was given to me, and I discovered that I had a large tumour in my right lung with lots of nodules throughout my right and left lung. After that, I felt a bit like, I suppose, I was on Star Trek Enterprise, but I was the only one in the spaceship. I really didn't know where we were going because we were waiting on some biopsy results. So shortly after, within a week actually, after I had my CT scan, I was referred to the Rapid Access Clinic down in Merlin Park, which I have to say is a fantastic facility that now exists for people in the west of Ireland. And there they did a bronchoscopy and they took some samples from my lungs. And that was the hold-up then. Then I had to wait for a number of weeks for the results to be in, and I didn't know what results they were waiting for, because as far as I now knew, I had lung cancer, and sure, that's a slam dunk. I thought it was a slam dunk anyway. So I had this feeling that I was in outer space with no big plan. So when I rung a few people that are in the service, they said to me, "No, they're waiting for your biomarkers, Deirdre, they're waiting for your biomarkers," and I didn't know what biomarkers were. I wasn't going to look up anything about lung cancer, so I went with it, and I continued to sail across the galaxy into places unknown on a voyage of discovery, I suppose it was. And then I got the phone call that the results were in for the biopsies and the oncologist was going to see me. The reason the oncologist didn't see me prior to this was because there was no point seeing me until he knew what he was dealing with and he could make a plan for me. So at no stage did he actually say, "I have bad news." So here we go again with the breaking of bad news. He never ever has said that to me. He's never told me I have a terminal disease. He's never told me I have a life-limiting disease. But, you know, I know what it is that I now have. But he's never said the words to me. And that's really important. I suppose I have a little jigsaw there in the corner, because having a good fit with your doctor is terribly important. And doctors out there, having a good fit with your patient is really important. If you don't have that good fit like a jigsaw, you can slam in the piece of a jigsaw and you'll get the picture. You'll get the image. But if you try to move that jigsaw around, it will come apart. So what we have, myself and my oncologist, is a really good fit. And he, that particular day, offered for me to look at the CT results. And I said, "No, you're all right. I have a picture in my mind of what my lungs look like, and I don't want that to be ruined." So he's always left it. He's guided me, but he's left it to me to ask the questions. I've never asked for a prognosis. And we've only ever discussed what stage 4 actually means once. And a lot of my friends who work in oncology said to me, "Don't worry about staging and numbers, it's only a number." And they're quite right. I mean, stage 1 of a tumour can kill you depending on where it is. So stage 4 is very much just a number. And so my oncologist went on to explain on that day about these biomarkers, because I had to wait quite some time to see him. And it was because they were waiting for these biomarkers. And I now know a bit about them. But not a huge amount. I just know the amount that I need to know and I want to know. There's 2 types of biomarkers they look for on cancer cells, and one is an autoimmune response biomarker, and that typically, if you have it, will respond well to immunotherapy. The other biomarkers they look for are mutations. And there's lots of different mutations that they can actually see on lung tumour cells. In fact, I've read about 12, but I think there's more. And the 12 that I read about subdivide into more mutations. So I'm sure there's people in the room who might have a better understanding of the mutations in lung cancer cells. But the 5 most common that I've been reading up on are these ones here. And that day, that consultant was telling me about my staging and about the biomarkers. He smiled and he said, I have good news. And I thought, sweet, merciful, how can we have good news in the middle of all of this? And he said, you have the EGFR mutation, which meant nothing to me. And that's the epidermal growth factor receptor. And he explained to me that with that particular mutation, what has happened is that my cells in my lungs have divided and multiplied at a rapid rate, too rapid for the body to actually get rid of like they normally would under normal circumstances. So tumours are formed, and those tumours can grow rapidly and they can spread. But because of research and because of advances, there are drugs available that will slow down that process and can stop it at times for a time. And this particular EGFR that I have is common in women, in people with lung adenocarcinomas, in non-smokers, in young adults, and in people with Asian descent. So I tick the box for women. I tick the box with the lung cancer, the lung adenocarcinomas. I tick the box for the non-smokers. And I thought I ticked the box for the young adults, but my husband would tell me otherwise. So the news was good, actually, is what he told me. So standard treatments until 2000 included chemotherapy, radiation and surgery for lung cancer. But that one-size-fits-all is very much a thing of the past when it comes to cancers now, and in particular lung cancer. Today, deeper understanding of the molecular basis of lung tumours lead to a much more tailored approach to the care. And testing for biomarkers uncovers mutations, additions, deletions and rearrangement in tumour cell DNA. So to make a long story short, I wasn't going to have chemotherapy, surgery or radiation. I was a good fit for targeted therapy. And the targeted therapy that I started on May the 14th was a drug called osimertinib, which I take daily in the comfort of my own home. I don't have to go into hospital to be connected to a chemotherapy drip every couple of days. And osimertinib will slow down the growth of the cancer. It can stop it at times, and you can take this until such time as you build up a resistance, because somebody spoke about this earlier, about cells becoming very smart, and they change, and they can eventually change so that the osimertinib doesn't work anymore. But my consultant has assured me that there are other drugs on the market, and more drugs will be produced, I'm hoping in years to come, that will actually satisfy the need that my tumour cells will have, and that will be to be paused and stopped. So that was my life from March 2021 until April of 2022. I had started to get back to some sort of normality. Now, I was able to do everything I did prior to my diagnosis, but it all had to be adapted. So I did go back to work, but from home in a part-time capacity. I did get back exercising, but the dog didn't realise we were running even. I mean, I ran short distances at a very slow pace, and the dog didn't even pant, but I was doing the whole lot of this. So in my mind, I was running. And then, as I say, on April the 29th, life was not done shocking me. And while I was driving the car through town at about 10 o'clock at night, just outside Lily's, as it happens, I suddenly was overwhelmed with the feeling that I couldn't control the car and felt that I was in a ship. So I stopped, thankfully, and pulled in, put on the hazard lights and closed my eyes. I had my 17-year-old son with me who did a fast assessment, because that's the sort of mother he has. I mightn't be home much, but I teach them the important things when I am home. And I had no facial drooping, I had no arm weakness, no speech difficulty. But they always, when they talk about fast, talk about time. Now, if it was left up to me, because I was busy trying to get on with my adapted life, and the following day I was on the basketball run, bringing boys from Sligo to Letterkenny, so I really didn't have much time for anything else to be wrong with me. So I asked my son to ring his father to come and collect us, because I knew I couldn't drive the car home. And while we waited for him, the Good Samaritan turned up. It was a GP who just happened to pass us and felt she had seen my son outside the car talking to me in the window, and she felt that she needed to stop. There must be something wrong here. So when my husband arrived, she told him that he needed to bring me to the ED immediately. I told him not to heed her, that she was panicking and that we'd go home and I'd sleep it off. But thankfully, he did bring me into the ED, and I sent him to home, telling him that I'd be ringing him in a couple of hours to come and collect me. But I didn't get home for 10 days after that. I had a vertebral occlusion in that blood vessel there running up the back of my head, and I had a cerebellar infarct. And that was the first time that I actually felt like a patient, because prior to this, my cancer was treated at home, and with monthly visits to the day unit and 3 monthly visits to my oncologist and to the CT scanner for surveillance CTs. But I never once felt like a patient. I felt I was getting older much quicker, but I didn't feel like a patient. But a stroke will make you feel like a patient, no matter how little or small people might think it is. I remember somebody saying to me, "You had a small stroke," and I sat there looking at her and I said, "Well, you have it and you'll see how small it is." You know, physically I recovered pretty quickly. I recovered after about 4 months physically. Initially I couldn't walk very far at all. I had some right-sided weakness. But I got home with the early discharge team, and I have to commend that service that we have here in the Northwest. They were excellent. I had a physio and an OT at home with me nearly every second day of the week for 6 weeks, and I eventually got physically back to where I was pre my stroke. But cognitively, it was a huge challenge. And even up to 2 months ago or a month ago, I wouldn't have been standing here speaking to you, because I had a huge problem trying to form sentences and remember words. So, but I must say, I have come back to where I was pre the stroke. But just in case all of you are sitting there thinking, "Oh yeah, cancer patients, they get strokes, that's why she had her stroke." They did a TOE on me in the hospital here in Sligo, and they did discover that I had a PFO. I had a hole between my two atria, in the septal between my two atria. I was born with that. It was a congenital abnormality. So I suppose I was lucky that I didn't have any problems up until the age of 52. And that was fixed, mended in September of this year. So I'm fully good to go. I have had the MOT. And my life as a patient, if I was to speak about a patient experience, I can't really do it, because my patient experience only occurred when I was an inpatient with my stroke. I don't feel like a patient now. I use the word survivor, but we're all survivors in life, really, aren't we? From the day we were born, we're trying to survive. But that's what I am, rather than a patient. What I would advise people after my experience with ill health is, for those that are clinicians, when it comes to breaking bad news, don't underestimate the skill that you can have and words that you can use that make a big difference in your patient's outcome, I suppose, really. I mean, if the consultant hadn't said to me that day, "How will you tell your children?" I would have been engulfed in the tsunami wave, and I wouldn't have done what I did and started, I suppose, living life on that day. I probably wouldn't be here today. So it's very important the words you use. It's very important how much information you give and where you give that information. They're all really important points that I picked up on. For people who have been diagnosed with cancer, or family members who've been diagnosed with cancer, or anybody here who might be diagnosed with cancer in the future, take your time coming to terms with your diagnosis. For me, I thought I had come to terms with it, but in fact I hadn't. I was afraid of it up until I had my stroke. So really, since May, I've been more accepting of my cancer diagnosis. Knowledge is power, and you need to choose the knowledge that you want to learn and make sure it's trustworthy information you're reading. I read nothing about lung cancer until I had my stroke. I felt empowered, I suppose, when the brain, maybe it was because cognitively I was a bit impaired, but suddenly I felt I was able to start looking up stuff. But it's very important that you look up the information from a very reliable source. I initially found that some of the papers I was reading were actually old, because advances have occurred in lung cancer treatment so much even in the last 5 years that information I was reading was actually old. So be aware of that and pick the information you want to read. Surround yourself with positivity and go back to normality as soon as you can, and as much more normality. It'll be a new normal. It won't be normal, but it'll be a new normal. And you need to accept the new you. That's the bottom line, isn't it? So today, what I wanted to do with my message, and I hope I didn't run too far over the time, but I wanted to raise public awareness and get rid of the stigma that's surrounding lung cancer. Start conversations about it. If anybody here is thinking about research and the work in laboratories, think about the lung cancer, because it's not getting as much funding or as much attention as other cancers are, and yet it is the biggest killer and in this country and throughout the world. People must have timely access to the best standard of care, whether it's new drugs, clinical trials or diagnostics, to ensure they have the best possible outcome. Stage 4 is not really good enough. Late diagnosis is not good enough anymore. And if there wasn't ignorance around lung cancer, somebody like me would have definitely gone to see the doctor earlier. If I had a breast lump, I wouldn't be waiting 8 months before I made a GP's appointment. That's a really important message. Lung cancer changes your life, but it doesn't actually have to mean the end of your life. And as I said at the beginning, the show must go on. Thank you.
I was saying I hadn't planned questions now, so we've agreed that we'll go with just listening to the story. I think it was so interesting. Thank you. Thank you so much for taking the time out and for telling us about your experience, because I think it really makes a difference. As a doctor listening to that, it makes me think about, how do I break bad news? What words do I say? What's my patient feeling? What about sitting in that room? Was there anything different that they could have done? And these are things I'm reflecting on, so it's really helpful. And you genuinely are writing this book, are you?
Yes, genuinely.
So I look forward to reading it and gaining insights from that. So thank you very much.
Thank you, Anna.